One, I want to thank everybody for taking some time out today to join us for our webinar. This is a series of webinars, the third in a series in which we're focusing on the patient experience. The first webinar focused on actually the patient in the clinic and how providers interact with the patient. The second of the series involved technology and how we can leverage technology to provide for a better patient experience and to provide for better outcomes. And then today, we're really excited. We have two terrific panelists that are joining us, in which we're going to focus on provider burnout. We think of the patient experience and how provider burnout can ultimately impact what that patient experience looks like. So as I mentioned, we're going to focus on provider burnout, and our goal is really the focus on the interplay between occupational stress and physician burnout, and diving down a little bit deeper, we're going to focus on defining provider burnout and provide a little bit of a history of its diagnosis, as well as identifying the causes and the impact of provider burnout. And for those that are experiencing provider burnout, where they can go to seek help. And then we're also going to, with Dr. Whitfield, we're very fortunate with that she offers provider coaching. And we'll learn a little bit about the program that's been established at Columbia Valley. And this may provide you with an opportunity to think about how you could implement such a program at your facilities. So we are really excited to have with us today Dr. Misha Whitfield. She's a licensed clinical psychologist and works closely with medical providers in her role as a provider coach. Dr. Whitfield, appreciate you joining us today. And if you wouldn't mind, just take a minute to share a little bit about yourself with those that are in attendance.
Yeah, I received my master's from Seattle University in 2002 and practiced as a mental health master's level therapist, and then went on for my doctorate a few years later because I just wanted to get a deeper understanding of patients and how to work with them. I did my pre-doctoral internship here at Columbia Valley in 2010. And then when I graduated, started a private practice, but then I knew that I really wanted to work at Columbia Valley because I love the providers, I love our patient population. And so 2013, I came on full-time as a psychologist. We run an integrated model, which we work closely with medical providers, warm handoffs, we'll see patients in the need of service if they're meeting with their primary care. And let's say their PHQ is really high, they'll pull us in right then and there. And so we'll be able to meet with them, kind of figure out what's going on with them, and then the likelihood of them actually coming back to see us is a lot higher. And so I do that. We have an APA accredited pre-doctoral program here. So we have 2 interns and we have 2 postdocs that we supervise. And then also I'm a provider coach.
Terrific. Well, again, Dr. Whitfield, really appreciate you joining us today. Also serving as a panelist for today's discussion is Dr. Warbe Ramos. She serves as medical director and practices family medicine at the Jeanette J. Phillips Health Center in Peekskill, New York. And Dr. Warbe, if you wouldn't mind, provide the same. Let us help us get to know you a little better.
Hi, everyone. Good morning. As Nick mentioned, I am a family medicine physician. I work for HRH Care. We are community health center. I'm also a site medical director here at the Peekskill site. I spend mostly, I would say 80% direct patient care and 20% in the administrative part of it. 20% officially, but a lot of administrative part during a day-to-day basis.
All right. Well, terrific. Well, thank you, Dr. Warbe, for joining us. And I thought to get the discussion started, I wanted to briefly discuss the history of the first diagnosis of burnout. So, one, I am not a clinician, and I'll be perfectly honest with you. And just prepping for this webinar, this was a little bit of Googling that took place. So I'll provide kind of the layman's understanding, but then I'll turn it over to the experts to provide a little bit better understanding of that first diagnosis and provide us with a deeper understanding of provider burnout. But in the 1970s, psychologist Herbert Freudenberger found himself working overtime at a thriving practice in New York's Upper East Side, as well as working at an addiction clinic. And with this grueling schedule and increased stress and exhaustion, he found himself unable to get out of bed. And after examining his symptoms, none of which seemed to fit any pre-existing psychological disorder that he was aware of, and he diagnosed himself with the first named case of burnout. So he wrote an initial paper describing a condition that exhibited physical symptoms like fatigue and headaches, shortness of breath, and emotional ones like frustration and anger and paranoia, depression and indifference. And he argued that those that are most susceptible were those whose work demanded emotional labor and empathy, placing what he called helping professionals, so doctors, nurses, social workers, teachers, and the like, most at risk. And we have a mix of administrative personnel as well as clinical on our webinar today. So having provided this layman's history of provider burnout, I was hoping I could ask you, Dr. Whitfield, if you could provide us with maybe a little bit more sophisticated history, as well as provide us with a little bit better understanding of what provider burnout means to you.
Yeah, I think provider burnout, is exactly the definition that you stated. I think medical providers are caregivers. They want to fix the patient. What's going on? Let me give you a medication. A lot of our patients are not compliant, and so then the provider gets frustrated. They feel like they're not doing enough, and they just can really get in their head. And so I think burnout is when you have literally nothing inside of you. So you're not being effective. Your confidence has gone down. Your satisfaction is lowered. The compassion fatigue is part of that. It's really difficult to hear patients when you're burnt out. You don't want to go to bed. You're not taking care of yourself. And so really with providers, when we start seeing that they're getting more patient complaints, it's kind of at first like, I need to check in with them. Something's going on.
Okay, terrific. And Dr. Warby, I'll kind of throw the question to you kind of as a follow-up. When you think about burnout, what does it mean to you? And curious as far as, amongst your colleagues, if you've witnessed any symptoms and what they may have been in the past.
I 100% agree. I think that burnout is overwhelming exhaustion, mentally, physically. You start noticing a detachment from work, a feeling of you're working, you're not accomplishing anything. It affects your productivity, it affects how efficient you are in general. Over the years, I definitely have seen it in colleagues, especially when they take a long time to take some time off. If you're working, and you decide to wait 6 months to take your vacation off, or you take too many weekends to work, or you're working 2 separate jobs here and urgent care somewhere else, or multiple shifts. If you don't take that pause to regroup, it's more not noticeable. The AFP have an article that I was reading actually recently. It showed that 54% of providers will at least report one symptom of burnout in their career.
That's interesting, and that actually kind of leads me into my next question. That number being so high, 64%. So I came across a recent study that found that provider burnout costs the U.S. medical system $4.6 billion every year. And I'm curious about the cost of burnout, but to be honest with you, not so much, that financial cost, not that 4.6 billion, but curious about what with our series being entitled The Patient Experience, what toll does the patient pay when the provider is suffering from burnout? And, for the provider that's suffering, what impact does this have on his or her life? Dr. Whitfield, if you wouldn't mind.
Yeah, it's interesting because providers, I think a lot of times they don't realize they're burned out. They just feel like I'm just working a lot. My patient panel, I'm seeing 25 patients. And really it's when patients are continually saying, I don't feel heard. You know, that's a big one. I don't feel heard. I feel dismissed. Even their body language, patients don't typically say body language, but they'll say my provider doesn't like me. And so when I shadow them, I shadow these providers, and it is body language. Maybe they're not giving eye contact. Maybe they're thinking about something else, or they're multitasking. And so really it's the patient just feels like they're not important.
Mm-hmm.
And they feel frustrated. And so then the communication in the relationship then needs to be repaired because it's been ruptured.
Sure. And tell me a little bit about what's the cost then on that provider, in family life or, away from the clinic?
They're isolating. A lot of the providers will isolate. There's an increased risk of alcohol use, substances. A lot of times sleep is a big one. One question I ask for medical providers is, what do you think about, what worries you when you go to bed at night? And most of them will say that they are ruminating and just obsessing about if they missed anything because they're exhausted, or is my patient going to die? So there's just this huge responsibility they have, and then they know the cycle. If they're not sleeping, then the next day they're not going to be able to really give that attention needed to the patients.
Sure. Well, Dr. Ramos, then let me bounce this off of you. So as a provider, you are all but required to put others first, throughout your day and constantly, I imagine. And this is something Dr. Whitfield just said, that you're thinking about what you could have done for a patient in the past, or what you could be doing for a patient in the future. And for you, serving in that dual capacity of both a provider and an administrator, I'm sure that you're not just concerned with your patients, but for your providers as well as their patients. Something that maybe you could share some of the the techniques or the rituals or therapies that you or other providers use, maybe to kind of take a step back during the day, just take a moment in the day to put yourself first.
So as a provider first, I like to take a minute, and this is actually the advice that I give my providers. When you're feeling overwhelmed, when you're feeling like is the 15 patients in a row that have 5 different medical conditions, complexity, and you have 15 minutes to do all of them. So you absorb all that, like the family problems that the patient is at, because as a provider you have empathy. You listen to your patient, and as a human is no way to completely separate one from the other, so you kind of like are absorbing all that energy. So I tell my providers, you have to have some time for yourself. Whether it's in the middle of the day, do a pause. It doesn't have to be like 10 minutes break. I'm talking about just 1 minute. Center yourself, deep breath in, and let it go. The same as when it's time to go to work, to go home. We do often take that job home. But you have to be able to say, you know what? It's time to stop working. It's time to note emails. It's time to know notes. Even if you have to complete 5 notes that you left from the day, just stop, because otherwise you never stop working, and that will drain you. As an administrator, I think that I'm not always can fix the problems, right? There are many things in our healthcare system right now. But just listen, right? Most of providers want to know that the same as the patient want the provider to listen to them, providers want their supervisor to just acknowledge that there is an issue, acknowledge that there is a problem. So mostly that, take the pause and listen.
Terrific. And I think that's kind of a good lead into at Columbia Valley, Dr. Whitfield serves as a provider coach, and I was hoping that you could share with us a little bit about how you developed the program, or what prompted the beginnings of this program, and what the program means to your providers, and then ultimately, by having this program in place, what does it mean to the patients of those providers?
Mhm. Yeah, I actually didn't start and develop the program. Actually, Dr. Rickard did in 2013. However, it kind of fizzled out. Providers had been here for a very long time. They were pretty resistant to coaching. They didn't feel like they needed it. And so it fizzled out. And then in 2015, I did a certification for provider coaching by an MD here in Seattle. And then I just full force went in. We were having a lot of provider changes. A lot were leaving because they were burned out. And we just decided that part of the onboarding was that they were going to have a year of coaching. And pretty much what that was is I didn't want to meet with the provider until after about 3 or 4 months of them seeing patients, because at that point we could figure out maybe what they were having difficulties with, what type of patients, like where they needed help. So I would give them the disc first to kind of figure out their communication style. And then I would have them do the wheel of life to find out where they are in their satisfaction. And then I would meet with them once a week for 3 weeks. I would shadow them for 2 hours. So basically just kind of follow them around and not interact. And and then after that, I would meet with them for 6 months bi-weekly, and then do 2 hours shadowing, and then once a month for the last 6 months. And what we noticed was providers, for the most part, they're new, they're just graduated. And so they don't get a lot of resources in how do I set boundaries and limits? How do I say no and it be okay? How do I be okay with a patient being angry at me? And so some of these things they would just start, we built a relationship. And so I was the go-to person when they were struggling with anything. And then with shadowing, it's just interesting because we had a midwife that was getting multiple complaints about just they didn't feel heard by her. I shadowed her one time and I just realized that when she was going into the room, just her nonverbal, she had her arms closed and there was just this distance. And I just told her, I said, to me, it looks like you don't really care. You're kind of being distant and you're pushing the patient away. And she changed that, and you just saw a total change in her patient satisfactions. So we have that. And then as I started meeting with all the new providers, the old school providers started getting mad because they weren't getting coaching. And I was like, especially pediatricians, they're very resistant. And so I just started working with the pediatricians. And so now if there's patient complaints or anything, our director, Dr. Butler, will say, do you want to go do coaching somewhere else, or do you want Dr. Whitfield? And 9 out of 10, they say, I want Dr. Whitfield. Because they trust me and I can tell them anything. One person had a really bad review and I shadowed her and I knew exactly what was going on with her. She just had a lot of family stuff coming up. And I asked her, I said, do you feel like you can match your patient? Like if your patient is anxious, you can have a little more energy. And if your patient is depressed, you can kind of tone it down and meet them. And she said, yes. And so I shadowed her and we walked out and I said, no, you can't, because there's a depressed, crying individual patient and her voice was normal and kind of bubbly and that's not a connection. And so it was those little moments, they're like, oh. So then they were able to kind of take a step back and find out, okay, I need to be more aware of this. So I love it. I feel like our providers are learning a lot. And if I feel like they need more than coaching, because it's very difficult to separate our family life. If you're having anxiety and depression or marital issues, we take that to work, even if we say we're not. It's how we interact with others. It's how we interact with patients. And I've told some providers, I think it'd be good for you to go to therapy
Yeah.
for your anxiety or for this because you're really hard on yourself or whatever, and they'll do that.
Yeah. I'm actually interested. You said something which actually kind of surprised me, that you said that you referred to them as some of the old school providers were the ones saying, hey, what about us too? Where I actually would have thought that maybe they might be a little bit more resistant because they hadn't been exposed to this. And look, I've been able to handle this my entire career. I don't need anything to. Did you see that there was any resistance, so that, I don't need that? Or did you find that for the most part that everybody was welcome to this type of coaching?
No, they were very resistant. In fact, they didn't want it until after they started hearing all the other providers saying how wonderful it is and they love it. And then they started feeling like, why didn't I get offered?
Yeah.
So it kind of had to be, it was a slow process, just like any relationship. I mean, if you're a new provider, you want that coaching because at least you have somebody to connect with.
Sure.
Someone that's been here for 15, 20 years is like, I don't need nothing.
Right.
So it's been really great.
Terrific. And let me ask you, so I may be wrong, but I would imagine that, well, actually, maybe Dr. Warbe, have you ever been exposed to any type of provider coaching in your experience? Has a program like this been made available to you?
No, actually, I just put a note because I love it.
Yeah.
Especially for the onboarding. And it's so funny that you mentioned the old school. Just an hour before this conference, I was talking to one of our providers about what is the difference between being an old provider and a new provider. I mean, if you're a new provider, you're going to this practice knowing that is 50 minutes. The older provider, they used to, if you've been practicing for 30 years, you used to have 30 minutes per patient just because you need to listen to everything. You have 2 hours of between lunch and conference and support and stuff like that. That the way that medicine is going, we're really not having that anymore. So it was very curious that you mentioned the old providers.
Yeah.
Mm-hmm.
Well, so correct me if I'm wrong. I would imagine that, Dr. Warbe hasn't been exposed to this. I would imagine that not all, and probably venture to say most facilities don't have some type of provider coaching in place. Is that accurate? And if that is the case, where would medical professionals go when, go for help when suffering from burnout? And maybe kind of as even a follow-up to that, are they actually seeking help?
My assumption is they're not, because I think what happens with providers when they're burned out, they're getting in trouble with the admin. They're being disrespectful. Their communication is really passive aggressive, and so really when then the admins are having conversations with these providers, they can't see because they're already far into it. And so we had one provider specifically that he was just not doing well. And he had been here for about 6 or 7 years. And I just went up to him and I said, you know what, let's just meet. Just come to my office, let's just talk. Because he was out the door. Like, he would have been fired. And so I just talked to him, and within 1 day of me having a conversation with him, before he would send any email out, he would have me read it, and then I would say, no, do not send that. Journal yourself, But he started recognizing and realizing, oh my gosh, therapy, they don't have time. On their 2 days off, they want to just do, go bike riding or whatever. So I think there's a stigma still with therapy. And there's a lot of program. I haven't heard of anyone that does provider coaching in a community health or a facility.
One thing that I would like to add to that, like most facilities will have some sort of coaching in a way as like an employee assistance program, right?
Yes.
We have that. Mm-hmm. With the program that Dr. Whitfield is mentioned, it is completely different. It's not the same doing a coaching while you are onboarding something as a prevention, as a part of a preventive medicine, for say it some way. versus telling the providers, hey, this is an assistance program, it's available for you, but it's still a stigma with the burnout. So if I reach out to the EAP program, means that I cannot handle this, versus let's give you some tools so that doesn't happen.
Mm-hmm. So then let me ask, you started to walk down the path of someone who was just about out the door before you began there to work with them. What's the ultimate experience if there's a provider who is seeking burnout, but this is the field that they've chosen? Long term, if they're not seeking help, what's the outcome?
Mistakes, misdiagnoses, patients dying.
And then personally, what's the experience?
Relationship, marriages fail, they're distant from their children. I mean, if I'm burned out, I have nothing inside of me to give to my partner, nothing. So then if I'm burned out and I'm not getting help, that relationship is just ruptured until I get help. And then I can say, whoa, I haven't been taking care of myself. We need to repair this. But if we're in the midst of it, it's hard to see through it.
Yeah. So maybe this is part of a conversation that should have been had maybe back towards the beginning. We've talked about what happens when provider burnout is settled in, someone is experiencing it. But Dr. Warbe, I'd ask of you, what are some of the leading causes that you've seen of burnout?
I would say paperwork, administrative duties. We have, as a provider, not as an administrator, as a regular provider, you do have a lot of extra administrative duties that we didn't used to have. There is an emphasis on productivity. I think that most providers go into medicine as a pure desire to helping people. When you're in your training, you are trained to do that. You're trained to diagnose. You're trained to sometimes even relate. They teach you some empathy. They teach you how to relate. They do not teach you about the paperwork and administrative part. And when you're going to work and you're faced into that, it's like, hold on, how I'm going to relate to my patient that have depression if I have to do 20 clicks and do the note and talk to her in 15 minutes. So you're faced with that. And that is one of the biggest factors.
Dr. Whitfield, anything to add that you could think of as far as cases or at least causes of burnout?
I would also say when changes, I hear this all the time with our medical docs. They say there's them upstairs against us down here. So just the feeling that admin doesn't hear. Decisions are being made without provider input. So I think that's a big one for our providers too.
So it's almost as if decisions are made on high and they're just placed down on those that are going to have to carry them out. And one may not be a full understanding of why it is that decision's been made, which I'm sure just kind of complicates it, or makes it a little bit more of a complex issue that, this is something I'm being told to do. I don't have an understanding of why, and I wasn't able to provide input as far as, as being the person on the ground. The one that's ultimately that decision is going to impact.
One thing that is related to that is, and I didn't understand this until I stepped into the role of site medical director. That is exactly what you're saying. You as a provider, you think, so why they're telling me to do this now? Why I have to add this click? Why I have to do this extra step? They're just asking for me. I don't have anything else to give. But all of those reasons, they have a reason to do, right? Mm-hmm. So one thing that I try to practice is the explanation. I think that the explanation is always very important. And as a provider and as an administrator, right? If I'm as a provider being told, you need to do this, and I'm not being explained the why, it will lead up to frustration.
Sure.
So if you're a provider and they're telling you have to do something, feel free to reach to your administrator and say, why we're doing this now? Because there's explanation behind it. And as an administrator, just when you're imposing something new, say the reason, because that way the providers are more receptive to it.
Sure.
And I want to add to that too. And with coaching, there a constant comment that I am stating to the docs is, have you discussed this with the medical director? No. Why not? Because I could get fired. I'll be looked at as the bad provider, or I'm and so there's this fear of being authentic and real because they don't want to be looked at as the problem child. So I will give them homework and I'll say, before I meet with you in 2 weeks, I expect you to send an email to whoever. And then it's really funny because I give them permission, and then they'll send me a little Athena text saying, I did it. But wanting that validation, like, oh, it was okay. The world didn't end, that you had an honest conversation, but there's a lot of fear there.
Yeah. Well, I wonder too, I imagine, Dr. Warbe, you being practicing, you do have providers around you, and not at every health center, at each clinic is there a medical director there. So I imagine that a part of this is almost kind of like, if the medical director is someone they may see once every couple of weeks, that may be more difficult, where they have, with your providers at your clinic, they see you on a regular basis and maybe probably feel a little bit more comfortable to come to you to maybe ask for the why of why something is being done. And I can imagine maybe there being some some timidness, perhaps, if it's kind of in the business world of, someone from corporate's coming and everybody is on edge, and you're not going to start questioning that person when they come in, but I can understand that from the perspective of the administrator. If in the messaging, I think it's a Simon Sinek with explaining the why, that's, if people understand why something is happening, they're going to be accepting of it a lot more easily than if it's passed on down to them. Dr. Warbe, I wanted to ask you, one thing that I've read multiple times and seen a number of different surveys, technology is often identified as a leading cause of provider burnout. Have you, maybe if you could just explain why that is. I've heard you talk about, clicks, going through the EMR, having to find things that are buried within the EMR, and how that seems to be a drain on your time. I think you had talked about, putting in notes, and sometimes it's just worth, you put that off for a little bit until you have time to, kind of center yourself and go back. Maybe if you could just kind of talk a little bit about what, how technology causes that frustration, that stress, but then also if there's forms of technology that are lessening that burden on those in the medical field.
It is going back to the old providers, first of all. So it just, there's a different where you're in your career as a provider, right? Some are more open to technology, others are more resistant. With every technology that is available for us, it's all about knowing how to use it on your favor. I do talk about clicks because that is what you hear if you're in a room full of providers, how many clicks you have to do. At the same time, those clicks will end up, if you use them properly and you learn how to use it on your favor, it will save you so much work in the long run, right? Mm-hmm. One of the things that one piece of technology that we are using is SyncTimes. We actually started using this, I think that we're about a year in. Irish Care adopted that model and piloted here in my side. Is very beneficial from the provider perspective and from the patient perspective. So when you have a piece of technology that can accomplish both sides, it is quite impressive. So SyncTimes is basically the best way that I can describe it is like a screen inside the room, outside the room, at the provider area and at the nurse's staff area. So what it does is allow you to communicate between provider, clinical staff, no matter where you are in the office. An example for the providers is if I need first of all, the the patient come in, so I know when the patient walk into the office. I know how much the patient have been in the room with the MA getting prep. I know how much time the patient have been waiting for me before I go in. What this key part is very important, because if I leave a patient waiting half an hour and I walk in like nothing had happened, the patient experience is going to be horrible. And the provider as well, because you're going to go into a room with a patient that is quite upset. Now, if I see that before going in the room, my the way that I introduce myself is going to be with an apology. I'm sorry that you've been waiting so long. Just by that, you're going to have a patient that is angry to a patient that is like, oh, thank you for acknowledging that. So it's going to make your office visit easier, and it's going to be their patient experience better. You walk into the room, you need a pregnancy test. So in the old days, you actually have to either put it in the computer and wait until somebody in the outside look at it, or just get out of the room, get your MA, get your supporting staff, and tell them you have to do that. With this technology, we can just put it in the screen, and because there's screens everywhere in the nursing staff, they can actually see, hey, the doctor need me, let me just go in and see what it is. So your office visit do not get interrupted, because that 1 minute, it make a difference at the end of the day. Not only that, the patient can see how much time you're spending with them. Sometimes you have patients, all of us have patients that you've been in the room for half an hour and you're about to leave and say like, that's it, you're leaving? Like, yeah, we've been talking for half an hour, right? But they can actually see how long you've been spending time with them. And not only that, at the end of the visit, I personally use it as a recap, right? So the patient know what we have talked during the visit, what I'm going to do, what is the next step, because most of them will forget at the time that you get out of the door. So you tell them, hey, I am going to order this blood work. I am going to put this immunization that the nursing staff is already prepping, because it is, I have ordered already, so she knows, right? And then you can go out and go to the front desk to make your appointment. So it improves your flow, which at the end of the day, if you have a good flow, every provider will be happier. And it improved the patient experience, because they are aware of what is happening, rather than just being in the dark room, in a room waiting for somebody to come in, right?
Terrific. I appreciate that, Dr. Warbe. And I'll ask you, Dr. Whitfield, just in your experience with meeting with providers, the numbers that I see, technology is always near the highest as far as some of the causes. And, also reading about, and, one thing that we really focus on here is being able to leverage technology to improve on both the patient and the staff experience. But just kind of curious, how much of a driver of provider burnout do you see technology being?
I would say not very high, because
Okay.
the newer, it goes back to the old school versus the newer ones. The newer providers, I mean, they would not know how to exist without technology.
Sure.
We just purchased a pediatrics facility, and these pediatricians have been in there maybe 30 years, and they were resistant to transfer to the EMR, but we purchased them and they didn't have a choice. I have been coaching one of the pediatricians, and he just hated the computer, and it's because he didn't really know it. They did paper charts. So finally, during coaching, he bought the Dragon, and oh my gosh, now it saves him an hour a day. So I just think it depends on how familiar we are with technology.
Mm-hmm.
Or if we're getting a new EMR, because then it takes time to really understand it. And like she said, if you're using the wrong clicks or you're not doing templates, then yeah, it's going to be more difficult.
Sure. Sure. Well, if I could just take a minute, I would like to speak briefly about the SyncTime solution. For those of you that may not already be aware, we offer a solution that improves communication in the clinic, and we're passionate about leveraging technology to provide for a better experience in the clinic, and that's for the patients as well as for clinical professionals. Data shows that by improving communication, patient alone time decreases, their satisfaction scores improve, and staff really appreciates a simple form to be able to communicate with one another. So, with our solution in place, and it's something, Dr. Warbe, who obviously is a user of our solution, gone are the days of searching the halls for care team members, or also for, gone are those days of maybe a nurse feeling or an MA feeling as if someone's always looking for me. I walk out a door and there's a provider waiting for me to, tell me about the care plan of a patient in another exam room, or the other way around for providers. All day long I feel as if I'm looking for someone. I'm, trying to find an MA or a nurse. So, really it does help out in just kind of those interpersonal relationships within care teams, that, there's an effective way to be able to communicate with each other on the care plan, and being able to communicate in real time as the provider is entering that the care plan into the EMR. So I would welcome the opportunity for those of you that are in attendance. Would welcome the chance to be able to show you our solution and explore how we can help you to better manage your patient flow and improve communication in your health center. And, and just kind of the tie-in, as we've tried to be able to provide these webinars as one, this certainly isn't a focus on SyncTimes. What we do, as we are focused on providing for a better patient experience, as we've talked about in today's discussion, how we can improve on the provider experience, how we can, through just some techniques that Dr. Warbe talked about throughout the day of, just taking a step back, or a coaching program like Dr. Whitfield mentioned. And this is what I was afraid of. So here we are right at time. Right now, you should all be able to see, I've placed a screen that has Dr. Whitfield and Dr. Warbe's email address on it. I would welcome you, if you do have any questions. They've both said that they're welcome to you reaching out via email for any questions. And I guess just with the last minute, if want to leave it to Dr. Whitfield, Dr. Warbe, if there's anything that you'd care to say, and as we wrap up.
Well, I just want to reiterate, burnout is something that it is quite frequently seen. My best advice that I have for everybody is just reach out to help before it becomes something very serious, right? As I mentioned, up to more than 50% of providers will have one symptom of burnout at some point in their career. There is no shame on being overwhelmed. So that taboo need to disappear. So ask for help. There is always program. Maybe not as Dr. Whitfield, that is like preventive, but many of the health centers or offices will have an employee assistance program that have this type of coaching. So don't feel ashamed or having to ask for help. Talk to your supervisor, and I'm sure that they will listen.
Yeah, and I just want to add, as a provider, it's really important to be aware of ourselves. I know that I'm not my best self when I'm not taking care of me. And so really important to take care of you. And I love therapy. I love coaching, doing it. And there's no reason not to. It's for your own life and life satisfaction.
Terrific. Well, I appreciate both of you joining us, and those that have joined us for this webinar. It's a very important topic. I'm glad that we were able to gather to discuss it. And again, Should you have questions, please feel free to reach out to each of our panelists, or should you care to learn a little bit more about SyncTime, I'd welcome the opportunity to speak with you. So on that note, we're right at time, and we'll go ahead and wrap up there. So thank you, Dr. Warbe. Thank you, Dr. Whitfield.
Thank
And
you, Nick.
everybody have a good day.
Happy Friday.
Yes,
Bye.
happy Friday.
Happy Friday.